Okay, so this is chapter 14, day 2. This was recorded for the class on September 29th, and their Google Classroom had their welcome work in it. And the next slide is a video, and it's a review of body mechanics. So again, you want to go to Google Classroom and go to the Google Slides for chapter 14, day 2, and you're going to want to watch that review for the body mechanics. We're going to skip over that one. Today we are going to be talking about environmental safety. So radiation is a risk. It's a major concern in radiology departments and in dental offices. In dental offices, when you have an x-ray, a lead apron is used to cover the patient before the radiographs are taken. And when that is done, it does cover most major organs and your reproductive organs, so not to cause damage to them. Now, if you've ever had an x-ray, the x-ray technician does leave the room, whether it's an x-ray of a limb or another body part or a dental x-ray, then the x-ray technician or the dental hygienist usually leaves the room so that they are not overexposed to radiation. Like I said, the dental worker taking the radiographs usually stands outside the room to activate the machine. So here is a picture of what it might look like. You can see here that the detector is kept close to the patient. There is a shield between the patient and the operator here. Down here is also a removable lead skirt. And the operator also has a radiation safety cap on and radiation safety glasses on with side panels. And then you can't really see it, but the technician also has a lead skirt and vest with a thyroid collar. And so the technicians have to do everything they can to remain safe so that they don't have overexposure to radiation. Here are the effects of radiation. It can affect the skin. It can cause, caught in the roots of the body here, causing skin cancer. It can result in lung cancer, breast cancer. It can damage the reproductive system. It also damages the bone marrow, thyroid gland, eye cataracts, stomach issues, bloodstream. Symptoms after moderate exposure can include fever, hair loss, vomiting, and diarrhea. If you know anyone who has had radiation for cancer, many times they become sick with other issues because the radiation does not only affect the cancer cells, but it's going to affect other areas. My uncle had radiation about 10 years ago for a rare nasal cavity cancer. And as a result, more than likely, he has some hearing loss that could be a result of the cancer or of the radiation. He also has his eyes tear up quite a bit, and he often has tears coming from his eyes. Some dementia that could be a result of the radiation, or it could be a result of the old age. So when someone is recommended to have radiation, they have to take into effect the pros and cons, the risks and benefits of the radiation, and whether or not that's something they want to do. Radiology departments, all machines that emit radiation waves must be checked frequently to make sure they are operating correctly and not leaking radiation. So they need to be checked to make sure they're not leaking radiation when they're not in use, and also they're not leaking extra radiation when they are in use. Radiographers should stand behind a protective shield when activating the machines, again to protect themselves. Personnel may wear badges that that measure exposure to radiation, and it can even look like a regular basic badge like this with a couple lines on it, and it will determine how much radiation that they have been exposed to. Radioactive iodine is a substance that can cause radiation exposure. It's used to diagnose thyroid problems and treat thyroid diseases. After it has been given to a patient, small amounts of radiation are present in the neck for several days, so the patient does become radioactive. So, of course, and when that is the case, they have to be careful of who they come into contact with. It's a beneficial treatment for patients, but the precautions must be taken to protect the patient's family and friends. Contact must be limited with others, especially those with children and with pregnant women. And if someone has had radioactive iodine, they should not be sharing their eating utensils, and they should not be sharing food with others. Other radioactive substances are used to treat cancer present With the same problems, radioactive seeds that are used to treat prostate cancer in men. So in the picture up here, this is a radioactive seed, and you can see how small it is in comparison to the penny. These radioactive seeds are inserted right into the prostate with the hope that they will kill the cancer or treat the cancer that's there. At times, the patients are kept in isolation for several days to prevent radiation exposure to others. So there could be an isolation at the hospital, or there could be isolation at home and just be kept away from other people. Medications and gases can be an environmental hazard. Drugs used to treat different cancers can be hazardous to healthcare personnel and pregnant individuals and must be handled with care. So in many cases, sometimes somebody else may prepare a patient's medications for them, and in most cases, the people would probably just wash their hands and then sort out their medications, but there's going to be some in which they should have gloves on when preparing it for their loved one or for whoever it may be they are, and then wash their hands when their gloves are taking off. Nitrous oxide is a gas used for anesthetic purposes, and it may cause spontaneous abortions in pregnant women. And so usually, for all women who are of childbearing age, if they have any type of medical treatment or if an ambulance has to be called for them, they're going to be asked if they're pregnant to make sure they're not given any medication that could hurt their unborn child. And we talked about mercury yesterday, but it is used in dental offices, and it used to be used in thermometers that can present a danger to people in the environment if it is not disposed of correctly. So again, you just have to dispose of that according to the regulations and laws. Individuals in the environment can be harmed by improper disposal of biohazard waste, such as needles and syringes. We talked about that in the last chapter. You cannot put the sharp boxes just anywhere you want to. You should call a company to take care of them, and that company is going to take care of them properly. Contaminated waste containing body fluids can spread disease if they are not destroyed properly. So again, any contaminated waste is considered to be biohazardous, and it needs to be taken care of according to the laws and regulations. All healthcare workers are responsible for identifying the specific hazards that present a danger to themselves, others in society, and the environment, and for taking proper precautions to deal with those hazards. So anybody in the healthcare field cannot have the attitude that it is somebody's problem to deal with. It is also your problem, and everybody has to take part in this. Every healthcare worker must accept their responsibility to use good judgment in all situations, ask questions when in doubt, and to follow the approved policies and procedures to create a safe environment. So it's up to the healthcare worker to know those policies and procedures. They have the legal responsibility to protect the patient from harm and injury. And if harm or injury does occur to the patient, then legal actions can be taken. There's basic rules that must be followed for equipment and solution safety. Do not operate or use any equipment until you have been trained to do so. We've talked about the Hoyer lifting class. That is a piece of equipment that you should be trained on before using, because if you're not using it properly, you could seriously injure the patient. So make sure you have proper training before using something like that or any other equipment. Read and follow all operating instructions. If you don't understand, you need to ask questions. And this is for any time you read instructions or given instructions. If you do not understand, you need to ask questions. Report damage or malfunctioning equipment. You do not want to try to use it at all. If it's broken or damaged, don't use it. Doesn't matter how much you need the equipment, you should not use it. Some facilities use a lockout tag system for damaged equipment, and that looks like this. So a tag is put on it so the equipment can't even be used, and of course it says danger, do not operate. So that tag would not be taken off until that equipment has been fixed. Do not use frayed or damaged electrical cords. Any cord where that plastic or rubber covering is frayed or loose, or if you can see the wires, that should not be used. And if that third prong is broken off, don't use it. That third prong is there for a reason, and it is needed. So Make sure the plug looks okay to use. And if the plug does not go into the outlet easily, do not use force to get in there. If it doesn't go in there easily, it should not be used. Never handle electrical equipment with wet hands, where you don't want any water surrounding you when using electrical equipment. Store equipment properly. Unused equipment should not be left in the patient's room, a hallway, or a doorway. And not only that, in the doorway, it would be unsafe for patients or people who are going in and out of the doorway. It could even be unsafe in the hallway. Another reason you want to put it back where it belongs, so that if somebody else needs that same equipment, they know where they find it. They can go to that spot and get it easily, and they don't have to search all over looking for that one piece of equipment that they need or want, because nobody has time for that. Observe all safety precautions for equipment. Read the SBS for hazardous chemical solutions for anything that you might be using. Check the NFPA codes on chemicals to determine the specific hazards associated with the chemical. We're going to talk about that a little bit more. Never use the solutions that are from unlabeled bottles. So if there's ever a bottle of a spray bottle of a solution, or even just regular bottle, there's no label, you should not use it. That being said, you also shouldn't say, oh, this has no label, let's dump it down the drain. It could be biohazardous, so you should not dump it down the drain. But you should talk to whoever is in charge of that to make sure that it's taken care of, because it should have a label on it. It is an OSHA violation to have chemical solutions with no labels on it. So here is the NFPA code, and as you can see, for the health hazard, this is a 3. So this material happens to be extremely dangerous. The fire hazard is a 2, so the flash point is below 200 degrees Fahrenheit. The instability is 1. It's unstable if it's heated, so this is something you're going to want to keep in a cool place. This W with a line through it means not to use water for this chemical. So this is labeled, and you should know what these saying what they mean. Read labels at least 3 times before using. So any chemical solution you plan to use, or any chemical, you need to make sure you read the label at least 3 times so you know what it is. And do not mix solutions unless instructed to. I don't know if you've ever, let's say maybe clean the toilet at home, and your mom says, or your dad says, or grandma, or whoever you're at with, says that toilet's not clean enough, let's add some bleach to it. And there's already a cleaning solution in there, and you add a bleach, and may create some very strong fumes that can actually make you feel sick. So you don't want to mix solutions unless instructed to, or if it's okay and you know the results. So you want to be very careful with that. And the example of the toilet, you want to flush the toilet a few times before adding bleach or any other chemical solution to it. We said that to read the labels 3 times. Don't mix solutions. Avoid solution contact with eyes or skin. Some can cause injury or poisonous to your skin or eyes. So if it does get into your eyes or your skin, you need to wash it immediately in most cases. So for your eyes, you would go to an eye wash station. We do have one here in the classroom that you can take a look at. You would open up your eyes with I would use my fingers to keep them open, because I would have a hard time keeping them open. You would lean over the eye wash and have the water go right into your eyes to rinse that solution out of your eyes. Avoid inhaling any fumes emitted by a solution. This can cause lung damage. It can cause a burning sensation. I used to use a cleaner to wash my shower. It worked really well, but the fumes were so strong from it. And at the time, I had a bathroom that had no window, so I would have the fan on, spray it, leave the room. And then when I would clean, I would put my shirt over my nose and hold my breath as much as I can, but I ended up stopping using that because the fumes were too strong for me. So you do want to avoid inhaling fumes. Store chemicals in locked cabinets following manufacturer recommendations. So some may need to be kept at a room temperature, while others must be stored in a cool room. Dispose of chemical solutions according to the SDS. So like I said, you can't just dump it down the sink. Report broken equipment or spilled solutions to your instructor or supervisor immediately. If anything is broken or spilled, you need to make sure you let the proper person know. So at this time, the students in the classroom, they worked on their workbook 14.1 and 14.2. And then you'll also want to read 14.3 for tomorrow's lesson, or maybe either tomorrow or it will be Thursday's lesson. So patient and resident safety. You do not perform any procedures on patients unless instructed or authorized to. So who gives healthcare workers authorization to treat patients? So some students in the class said supervisor, and that is the case other times. So as an occupational therapist, could I walk up and down the hallway and say, oh, there's Fred. It looks like he needs some occupational therapy. I'll go in and evaluate and treat him. Or can a nurse go into a patient's room and say, oh, this patient needs medication. I'm going to give him this medication. No, we cannot. The doctor gives the authorization and the orders. So even as a home health care occupational therapist, I would get an order to evaluate a patient. So I'd go in the home and evaluate the patient. I would then have to call the doctor and get approval before I went to see that patient again. So I'd call the doctor and say, hey, I just saw Mr. Fred, and I would like to continue seeing him for 3 times a week for 4 weeks for upper extremity strengthening, ADLs, IADLs, for urinary incontinence, and transfers. Is that okay if I do that? And then the person on the phone would say, yes, I can give you approval. Or they will say, no, I have to talk to the doctor and get back with you. So whoever gives me approval, I would say, Susie at Dr. Frank's office approved OT plan of care at this time and on this date. So you always write down who gives you their approval. Nurses there might be some nurses who can call a doctor and say, hey, this is what's going on with this patient. I recommend this medication. Will you write an order for that? The doctor may say, yeah, sure, I'll write the order if they trust that nurse well, or if they've worked with that nurse for a long time, or they may say, hey, nope, not yet. I want to see the patient first, have the patient come in, or I'll go out and see the patient. Home health aides. When they go to see our patients to give them a bath, they have very specific orders to follow. So maybe they've been instructed to give the patient a shower, to wash their hair, to put their clothes on, to dry them off, and to comb their hair. Maybe they go in to see that patient and they say, oh, I'm just too exhausted to take a shower right now. I just don't feel up to it. I'm just weak and I feel like I might fall. Can we do a bed bath instead? So that home health aide would have to call the supervisor and say, hey, this patient wants a bed bath instead. Is that okay to do it? And then more than likely the supervisor would say yes, and it would be documented that they were given a bed bath instead of a shower. If that patient wants lotion on their feet, unless it's in the orders to put lotion on their feet, that home health aide cannot put lotion on their feet unless authorized to. So they could call the supervisor to get authorization for that. Even as an occupational therapist, I wasn't supposed to put Band-Aids on any patients unless I had an order from the doctor. So the doctors the orders come from doctors, and if you're the one who wants to give the orders, then become a doctor. Make sure you have the proper authorization, follow instructions carefully. So sometimes as an occupational therapist, if I was the last person to call the doctor's office about a patient, sometimes they would call me and give me medication changes for patients. I never liked that part because I'm not the greatest with all the medications, but they would give me instructions. This medication needs to be changed. They were taking it once a week, and that doctor now wants them to take it twice a week. Twice a week or twice a day, more than likely. And I would say, okay, I would write the order. And then I also asked the nurse, do you want me to call the patient? They would say yes, they call the patient. No matter what, even if they had called the patient, I would probably call the patient also to cover myself. So if I always repeated the instructions back to whoever had called, usually the nurse. I would say, okay, so the doctor wants them to take this medication for this amount of time, to make sure that I heard it correctly. So I would then call the patient and either talk to the patient or a family member, depending, and say, hey, this needs to be changed. And then would I hang up the phone after I told them what needed to be done? No, I would always check for understanding. So I would have them repeat the instructions back to me. So that when I documented, I could say I talked to so-and-so in the home of the patient, gave them the instructions, and they repeated the instructions back to me, showing understanding of what needed to be done. Again, ask questions if you don't understand. Anytime you're given an order or instructions to do, if you don't understand, you need to ask questions. Use correct or approved methods while performing the procedure. So sometimes, working in the healthcare field, you get busy. It's busy. Even in home care, sometimes I had a lot of patients I needed to see, and it seemed like I was always running behind. And in the hospital, there's a lot of patients to see and to deal with, or to work with. So it doesn't matter how big of a hurry you are in, you need to make sure you use the correct approved methods. Don't take any shortcuts or use any incorrect techniques. So let's say there's a patient who is supposed to only use a Hoyer lift to be moved. A Hoyer lift does not get done quickly. It does not take 2 minutes to move a patient like that. It takes time. And let's say, you're in a hurry, you have more patients you need to see, so you're like, oh, let's get 2 more nurses, we're all strong, we can move the patient. No, that's not the case. You have to use the Hoyer lift to move the patient. That's what it's supposed to be done. So it doesn't matter how big of a hurry you are in, patient safety is always your #1 priority. Provide privacy for all patients. So this can include closing the door and pulling the curtains on a patient. I had a patient once when I was up north in West Branch, so I was relatively new occupational therapist, and this particular patient had to be moved with a Hoyer lift. He was a pretty big guy, and I knew his granddaughter personally, and I saw her while he was in the hospital, and I was not with the patient when this occurred. And she said, yeah, I just went to see my grandpa, and I saw way too much than I wanted to see. He was being moved in a Hoyer lift, and he was exposed. And it was not the way his granddaughter wanted to see her grandpa. So if that was the case, and again, I don't know the whole circumstances, I just know she saw too much of him that she wanted that more than she had wanted to see. The door should have been shut and the curtain should have been pulled for the extra protection. So usually a shut door should mean that people should knock, and someone knocks, then who's ever working with the patient should say, hey, who's there, and find out who it is. Okay. Let us get so-and-so settled a little bit more before you come in. Or, maybe if it's a spouse, they may say, I don't care, I would like to come in now, and then you would check with the patient to see if they could come in now. Maybe if a person doesn't knock, they may just walk in, and hopefully you can hear them walk in. Or you might see them start to move the curtain, and then you would stop them there to say, hey, you know what, he's not decent, let us get him situated more. But you want to pull the curtain and make sure patients are decent before other people see them. Knock on the door before entering a room. This is so important. In most cases, you want to go to somebody's house unless you know them really, really well, and you're not going to know your patients really, really well, so you need to knock on the door before entering the room. That is their space while they're there. Even if I saw patients who I knew were in a coma, or I knew who couldn't talk for whatever reason, I would still knock on the door. As you knock, you speak to the patient and you identify yourself. Hey, it's Renee with Occupational Therapy. Is it okay if I come in? You need to ask permission before going into the door. And then if the privacy curtains are closed, you need to ask permission before going on the other side of the curtains. You need to tell them your name, tell them who you are. You may have to stand outside the curtain and explain more about who you are. But do not go behind the curtain before the person gives you permission to. Close the door and draw the curtains for privacy before beginning a procedure on a patient. Now, if you were going in to see a patient, all you were doing was taking their vitals, you wouldn't necessarily have to draw the curtains. But if you're doing a more private procedure, then you need to close the curtains along with shutting the door. Identify your patient. You want to make sure you have the correct patient. You can do that by saying their name, and you want to say their name at least twice. You can check their wristband, and you can also, maybe if there's a record on the bottom of the bed, you could check that also. So also going with patient privacy is if you go to see a patient and there's several people in the room, you first need to ask if it's okay if you come, and of course, and then is it okay if you do such and such with your family members there, or You may say, I need to ask you some private questions, or I need to ask you some health questions. Is it okay if I ask you now, or do you want me to wait? Because it could be their spouse, but maybe they don't want their spouse to know that they have cancer, or their children to know that they have cancer. So whenever people are present, you always need to ask, make sure it's okay if you talk in front of them. It could be a HIPAA violation if you do not. So as an occupational therapist, I would see patients, and many times I had family or friends with them when I would see them, do the evaluation, and tell them, hey, I'm doing the OT evaluation. Is it okay if I do it now when your family and friends are here? And sometimes they would say yes, or sometimes they would ask the people to leave, or ask me to leave even. And also later on during my evaluation, I would always have to ask the patients about urinary incontinence. If they have urinary incontinence, it means they can't get to the bathroom on time. This can be a very touchy subject for many people. Sometimes they don't want their children to know that they have a hard time making it to the bathroom. And so even if I already asked if I could, do the evaluation in front of their family and friends, when it came to that topic, I would always say, hey, just to let you know. And sometimes I would say it quietly, I had to ask you some questions. They're personal questions. Is it okay if your family or friends are here while I ask you those questions? Some would say yes, some would say no. If they say yes, then I would say, okay, just to let you know, I am asking you questions about getting to the bathroom on time. So again, sometimes they would say yes, or sometimes they would want their family members to leave, or I would wait until another visit to ask them that. So always also be aware of who's in the room with you to see if you're able to ask those private health questions or talk to them about some health procedures. Explain the procedure and answer any questions, even if it's something as basic as a blood pressure. You don't want to just go in someone's room, hey, and put a cup on them. You always make sure you had the patient's consent before performing any procedure. So my mom was in the hospital. She needed a blood draw, and they had come in to take a blood draw, and she refused. She said, no, I just have blood drawn. If you need to draw any more blood, I want all the tests done and blood drawn at once. I'm not having you. Truthfully, I was not happy with her, but she didn't care. She refused the blood draw. Now, if that phlebotomist had said, you know what, it doesn't matter because I have doctor's orders to follow and I have to follow these orders and we're getting your blood whether you like it or not. And she came over and clamped her hand down on my mom's arm and took her blood. Do we know what that might be considered as? Not might, it is considered. It is considered to be assault. If someone refuses treatment or a procedure and is done anyways, it's considered assault as soon as you lay a hand on that patient, and legal action can be taken and you could have your license taken away. So if a patient refuses, they absolutely have the right to refuse. Never perform a procedure if a patient refuses to allow you to do so. They always have the right to say no. Observe patients closely during any procedure. You want to report any changes that may occur. Do they get really sleepy? Do they get really pale? Do they get sick? Always be alert to the patient's condition at all times. If I'm walking with a patient, I want to be aware of their face and what they look like. If they all of a sudden go white as a sheet, it could be they might do that before they fall. So you always, how is their breathing when they're doing whatever. So you want to be alert to the patient's condition at all times. Check all areas for safety hazards. You want to make sure everything is safe before you leave the area. Report any unsafe situations immediately to the proper person, or correct the safety hazard yourself if you're able to. Before leaving a patient, observe all safety checkpoints. So this mainly has to do with in the hospital. You want to make sure the patient is comfortable. Do they need an extra pillow? Do they need a blanket? Do they need their blanket off? Are their feet cold and they need socks on? Is their drink near them where they can reach it? So you want to make sure, is their head in the right position? Make sure that patient's comfortable before leaving the room. You want to make sure the side rails are up, and that's a safety issue. And the bed is at the lowest position. So hospital beds do rise and lower in height. So the bed might be raised if you're giving a patient a bed bath or you're doing a procedure and you don't want to bend over. you need to make sure it's lowered back down to lowest level before leaving, especially if a patient is shorter. And if they swing their legs out of bed, you don't want to have them, they need to be able to touch the floor. You want their feet to touch the floor. You don't want them to have to hop out of bed. That's not safe. You want to make sure the wheels are locked. So hospital beds do have wheels on them. Sometimes another staff member may unlock their bed in order to move their bed to do something. Even a family member may unlock the wheels so they can move their bed for whatever reason, and then the wheels may not be locked again. So it's a good idea just to give it a light tug to make sure the wheels are locked before getting your patient up or before even having them sit on the bed. You want to make sure their call light button and other supplies within their reach. So the call light button is their button that they use to call for help, to call for a nurse. So that is very important. It's close to them. Usually that device, the call light button, would be something like this, and that red button right there is probably the call light. It's also many times their remote control buttons for their TV. So people like to have that. They want to be able to turn their TV on or off when they want to. You want to ask them, where would you like your bedside table? Do you want it right beside you? Do you want it over the bed? And put it where they want. And you want to make sure they have water in their cup, and is their cup within their reach so that they can reach it? Is their phone within their reach? If they have a cell phone, is that within their reach? Or their book that they want to read? So whatever they need, you want to make sure it's within their reach. And you can ask the patient what they would like. Leave the area neat and clean. So if you change the sheets of the bed, you don't want to leave the sheets on the chair. If you do a dressing change, you don't want to leave the dirty dressings out or a pair of scissors out. You want to make sure everything's put away where it should be. And of course, wash your hands before you leave the room. So that's it for today. For tomorrow, you want to finish reading the remainder of the chapter 14. As always, if you have any questions or any concerns, be sure you contact me. You can look in Google Classroom to look for these slides, and make sure you go back to watch that video that we started off with. So thank you very much.